So now what do? You have multiple patients in the back of your ambulance. Maybe you went on a minor collision, but you have a few patients from that. Well, you want to number them. Patient 1. And then you give all the whole report for patient 1. And then you move on to patient 2 and you give the whole report for patient 2. Present them in order from most serious to least serious. All right, so more on using the radio. Be courteous. Try not to show emotion, and do not ever, 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 ever curse or use obscene language. Do not vocalize pauses, and that means the or whatever it is. And last, don't unkey your microphone until you have finished talking. So that's it for the radio communications. I'm going to move into interpersonal communication. And that's really, you can see inter is between, and personal is people. Between people communication. This is one of those skills that I think is most underrated, and also very highly rated depending on where you go. I think we kind of take this for granted. I certainly coming out of high school and going into college thought I was great at talking to people, and looking back I was absolutely horrible. And I think it's really important to recognize that basically nobody is good at this. Everybody, no matter how long you've studied it or how long you've worked on talking to other people, nobody is good at this. So we always, always, always have room for improvement. So here's the deal. Start by making and keeping eye contact. Be confident. So confidence in yourself is going to inspire trust from the patient. How do we become confident? It's kind of hard to just be confident, right? We study, we practice, and we practice not until we're doing it right most of the time, but we practice until we can't get it wrong. We practice assessing patients, we practice vital signs. That in turn is going to turn into confidence, which is going to lead you to be more trustworthy in the eyes of the patient. Be respectful. Use proper names unless told otherwise. And if you haven't remembered to get their name, use sir, use ma'am, Mr. or Mrs. If they have a rank that you're aware of, like a captain in your organization or a commander, don't ever speak condescendingly. Hun, darling, sweetie, cutie, honey. Don't use any of those, ever. And be conscious of cultural differences. We'll talk a little bit about some cultural awareness type stuff, but recognize that people from different cultures view things very differently, and that that's okay. And sometimes they may not want medical treatment. They may have some issues with how Western medicine is practiced. Don't be offended by that, and recognize and be respectful of their culture. Again, be courteous. Please, thank you, yes ma'am, or yes sir, no ma'am, no sir. And I want to hear this in class. Everything needs to be ma'am or sir, and there definitely needs to be please and thank you. And be truthful. One thing I've found in my own life is it is so much easier to just be truthful and admit your own mistakes than it is to try and cover everything up. Just be honest with everything and be truthful. So one of the cool things that we get to learn in this class is a bunch of really cool new terminology like acute coronary syndromes. Any of you guys know what that is? The patient's family probably doesn't either, and the patient may not. Instead, when I change it around and say, you could be having a heart attack, that is something that the family understands. So use terms that the patient or family will understand. This is your responsibility to know when to use fancy words like acute coronary syndrome and when to use things like heart attack. Be careful of what you say about the patient and where you say it. This is especially true in family, sort of tense family situations. Maybe it's a mom and daughter. Maybe the mom called about the daughter, and the daughter's, 19 years old and can make her own decisions. Just be careful about what you say about the patient and where you say it, and be very aware of your body language. Look at this guy in the picture. What do you see? I see that he has his hands on his hips. I almost feel like he's looking down at me a little bit. I feel like he doesn't necessarily care. If he were somebody coming to try and help me, I feel like he doesn't really want to be there, that he feels really impatient, or that he just doesn't want to take care of me. So be careful of your body language. Make sure to speak slowly and enunciate. I'm really bad. I speak really quickly. And I have to really focus on making sure I speak slowly enough that my patients understand me. And allow time for the patient to answer questions. Some patients need more time than others, but give them the quiet that they need to think about the answer to your question. If the patient does not speak English, use an interpreter unless you know exactly what you're trying to say. Don't attempt the language if you're unsure. There are interpretation services. There are even some really cool apps for like iPhones, smartphones, that are interpretation apps. The other thing you can try is use flashcards or draw pictures. Figure out something. Find some way to make it work, because you're responsible for taking care of the patient. For the hearing impaired, it could be that you need to use an interpreter for sign language. Be sure to face the patient when speaking. It allows them to see your lips, and it allows them to see your facial expressions. And honestly, facial expressions and body language are going to communicate like 80% of your message. Now, it's still going to be hard for, communicating if something hurts, or, if they're feeling sick to their stomach, or to ask, what's the last thing that you had to eat? But it can certainly let them know that you care and that you're working on a solution for them. Kids. So with kids, be sure to get on their level, approach them slowly, avoid threatening postures, and explain everything that you do. Sometimes it's helpful to, do it to mom first, or the baby, or to the baby doll, or to the toy, or whatever it is. But get on their level and explain everything that you do. It's okay to be honest with them about things that may hurt. Don't lie. Respect a child's modesty. Use the parents to help calm the child as long as the parent is calm, and this is key. Let the parent hold the child if it's not contraindicated, and allow the child to keep familiar objects like a teddy bear, or maybe a book, or a blankie. With elderly patients, use the last names of older patients until told otherwise. Mr. Smith, I see that you're having some chest pain. Don't use slang. Proper English. Don't assume senility, deafness, or infirmities. I have a tendency to be loud anyway, and I did have a few patients call me out on, why are you talking to me so loud? I'm not deaf. So don't assume that. Be aware of cultural differences, and by cultural I mean not due to the culture they come from, but because of the age. There are differences. One of the things kind of with my age group is we use the word dude a lot. Hey dude, how's it going? I don't know if that's still true of people growing up, but for me, and my peers, that's not disrespectful. But when I'm talking to someone from a different generation, it's completely disrespectful, and they're offended by that. So be aware of that. Don't rush the patient unless they're sick and don't know it. Unless they're sick, really sick. And take some time to attend to the family. If the family's standing around, be sure to talk to them if it's okay with the patient. As long as the patient gives you permission, it's allowed. But attend to them. Make sure they understand what's going on, where the patient's going. Make sure they know how to get to the hospital. So directions to hospital. And if you have a chance, get a contact number. Because it happens on more frequent occasions than you'd think, that if you pick one hospital, something changes while the patient's in the back of the ambulance, and now you suddenly need to go to a different hospital. And it's really nice for you to let the family know that you've decided to change hospitals. They get really upset when they show up at one hospital and find out that their family member is not there. Well, that's it for this lecture. Please be sure to complete the quiz associated with this lecture before you come to class. And if you have any additional questions, be sure to bring them into class.